Good morning everyone. My name is Emma Burnett and welcome to my senior TED Talk. Before we begin, I want everyone who's ever felt disregarded, unheard, or dismissed by their doctor in the doctor's office to please raise their hand. Alright, great. Now keep your hand up if you identify as a female. If you look around the room, you can tell that a lot of the people that initially raised their hands kept their hands up. This is because a lot of women are often disregarded, unheard, and dismissed by doctors in the doctor's office. My research question was, how are the health diagnosis and outcomes different for women when it comes to heart attacks and autoimmune diseases, and what causes these differences? Today we will go over the results of my research and dig into the roots of why women are more commonly misdiagnosed, mistreated, and have lower health outcomes than men. I have found that many women have felt that they aren't being accurately heard as they are explaining their symptoms. Often physicians are ignoring the complaints or comments made by their patient and purely focusing on what they know and see. Evidently, women have often experienced a series of misdiagnoses and poor health outcomes in terms of heart issues and autoimmune diseases. This issue is because there's a significant lack of knowledge on how they represent differently in female patients rather than men. Studies have shown that women's pain is more likely to be dismissed or attributed as psychological causes, delaying critical interventions. According to the UCL News, a study was conducted that found gender stereotypes are particularly decisive in the estimation of patients' pain. Because of the false belief that women are oversensitive to pain and express or exaggerate it more easily than men, healthcare staff, both men and women, often discount women's verbal reports and nonverbal behavior expressing pain. Alright, a common experience for women in the doctor's office is a term known as medical gaslighting. Medical gaslighting is a form of psychological manipulation that occurs when a healthcare professional denies, dismisses, or invalidates a patient's legitimate medical concerns. This is often experienced by their female patients. Many women have felt that they aren't being accurately heard as they're explaining their symptoms. In her research paper for the Columbia Journal of Gender and Law, Cecilia Plaza stated that women who report symptoms of chronic pain conditions, which are the leading cause of long-term disability in the United States, as well as affecting more women than men, are likely to be told by their healthcare providers that their symptoms are all in their heads, or that they should learn to live with their pain, or that because they look good, they must not be in as much pain as they claim to be. Healthcare professionals and the medical system are seemingly failing women with their responses and treatment of women's pain. It is more common for women to only receive minor tranquilizers and antidepressants over pain medications and are less likely to get further diagnostic imaging or investigation than men. Women's pain is commonly seen as rooted from an emotional or psychological cause instead of a health issue. This phenomenon, often referred to as medical gaslighting, leads to unnecessary suffering and a lack of trust, both between female patients and their healthcare providers, as well as healthcare providers and their patients. The consequences of these biases extend beyond individual experiences. They represent a systemic failure to provide equitable medical care, ultimately affecting millions of women worldwide. Many issues that women face in medicine are the result of being unfairly underrepresented in medical research throughout history. As you can see here in this image, it was not until 1993 that women started being included in medical and clinical testing and trials. Until the 1990s, women were routinely excluded from clinical trials, meaning that medical knowledge was purely derived from testing and knowledge built on the male physiology and body. This exclusion was not incidental, but rather a systemic practice that left researchers researchers with very limited insight into how drugs, treatments, and diseases influence women differently. The lack of female representation in trials meant that physicians were often basing their diagnoses and treatment plans on research that did not account for the unique physiological and hormonal influencers of women's health. This issue has evolved towards a better understanding of female biology, although it has constantly reflected and validated a more dominant social and/or cultural expectation of women. Men are often held on a more higher pedestal than women when it comes to researching and diagnosing patients. Megan Frego shares her story stating, "I started going to doctors talking about my tiredness, body aches, insomnia, migraines, and weight gain. They told me things like calories in, calories out. You need more vitamin D. You need to exercise more. And you're just getting older. I begged and begged for help from doctor after doctor. I kept being told I was fine. I finally got diagnosed in my late 30s with 2 autoimmune diseases by a rheumatologist. I've been suffering for years, and the first night I slept through the whole night, I cried. My pain is gone most days. I was so relieved and frustrated at the same time." Megan is just one of millions of women worldwide who have been pushed aside by doctors for heart diseases and/or autoimmune diseases. In my research, I dove into how autoimmune diseases and heart and cardiac issues represent differently in women and how they're often misdiagnosed, mistreated, and leave women with lower health outcomes. First, let's talk about autoimmune diseases. On this chart, you can see the most common autoimmune diseases across the United States that women experience, as well as how many female patients are experiencing these in comparison of male patients. Autoimmune diseases disproportionately affect women, as you can tell, yet they're often misunderstood, misdiagnosed, and inadequately treated. Due to the gender bias in medical research, about 80% of autoimmune disease patients, which are women, as represented here on this graph, have been undertreated or ignored by physicians. These conditions frequently present with vague and overlapping symptoms, such as fatigue, joint pain, and brain fog, which can be easily dismissed as stress, depression, or anxiety, rather than being properly investigated. It is common for women to be gaslit over symptoms such as heavy bleeding or pelvic pain. Because physicians are typically not taking patients seriously, they often get diagnosed with more mental health issues rather than physical health issues. More vague symptoms, such as having lower mood or being more fatigued, are dismissed as depression or anxiety, rather than being recognized as an autoimmune disease or disorder. When it comes to cardiac issues, women often have different symptoms than men, as represented here in this image. They are more commonly misdiagnosed and mistreated, resulting in lower health outcomes. Due to misdiagnosis and delayed treatment, women have a higher mortality rate than men when it comes to heart attacks in the United States. Kevin Bybee, a certified board and fellowship-trained cardiologist with St. Luke's Cardiovascular Consultants, claims that around 3 million women in the United States are suffering from a myocardial infarction every year. Now, I want 3 people to take a guess on how many women die from coronary artery disease each year. Just a guess, any number.
4 million.
Lower than that. That's really high.
50,000.
Higher than that.
200,000.
Actually, you're right on. There's approximately 213,572 women that die from coronary artery disease each year. That's a lot of women. This year is the first time in the US that death rates by cardiovascular disease in women have been higher than men. Progressively, this issue with cardiovascular problems being misdiagnosed in women is getting worse because there is a lack of knowledge. I didn't mean to do that. Research has consistently shown that women experiencing heart attacks are more likely to have their symptoms dismissed or misattributed to non-cardiac issues such as anxiety, indigestion, or stress. Symptoms have proven to show up differently between genders. Dr. Jelani stated that men are more likely to have classic chest pain and fatigue. Women are more likely to have an atypical presentation, including symptoms such as shortness of breath and nausea. Coupled with guidelines created for men, this can lead to a misdiagnosis in women or a misdiagnosis with the issue being categorized in a different way, such as gastrointestinal problems or anxiety. We can move on. Okay. I truly believe that there needs to be more research done on how common health issues will show up differently in the female body. I also believe that we need to look at how different physiologies react to the treatment options that have been created for these issues. Unfortunately, there is not enough research done on the female body and physiology as a whole. And by gaining a better understanding of what happens within the female body, we will be able to understand our patients in a brighter light. I believe that we must integrate more and newer research into the female body through medical education and textbooks. This will advance the closure to the knowledge gap and with these issues as well as many other ones. Historically, there has been close to zero information on the female body in medical textbooks. Medical education is still lacking coverage of issues pertaining to women in the teachings about certain disorders. There's a lack of female subjects in medical research and cross-discipline aspects of women's health, thereby exposing a very clear gender bias in medical research and education. For my senior project, I am hosting a Movie in the Park event fundraiser to support the Lubman Family Center for Women's Health. This organization is part of the Anschutz Medical Campus at CU Boulder. It was created and run by women who have been inspired by this issue previously throughout their medical careers. Over the last 20 years, the Lubman Center has provided funding for more inclusive research. This is making a significant difference in women's health across the country. I have chosen this medical research center because I will be going pre-med at CU next year, and I want to continue my research in this issue and hopefully bring a better closure to this gap. The systemic gender bias in medical research has led to generations of misdiagnoses, inadequate treatments, and preventable suffering for women, proving that a male-centered approach to medicine is both dangerous and outdated. True progress demands urgent action. Without inclusive research and equal medical consideration, we are not just neglecting women's health, but actively endangering lives. Please consider donating or purchasing tickets to support the Lubman Family Center for Women's Health Research with this QR code, and hopefully coming to my Movie in the Park event on May 2nd at 7 p.m. at Santa Rita. Thank you for listening.